Hello students, welcome back. So last time we discussed the health problems of elderly. We will continue with the same topic in this lecture as well. So health problems affecting elderly people of both the genders. There will be increased susceptibility to adverse effect of physical environment like heat strokes, heat exhaustion, generalized hypothermia, local adverse effect of cold. तो everybody can suffer ना, हर किसी बंदे को कोई हो सकता है ऐसा at any age people will have these problems. लेकिन with the progress of age जो जो आपकी उम्र बढ़ती जाती है तो you will be more susceptible to these conditions. So then other condition that psychological and degenerative neurological diseases like dementia है, अल्जाइमर डिजीज है, पार्किंसोनिज्म है, ये सब बीमारियां जो है ना ये एल्डरली एज ग्रुप में ज्यादा कॉमन होती हैं. Okay, then depression is also common in elderly people. It is as compared to younger age group. So elderly people they more suffer from the depression. The reasons can be many reasons. Okay, social isolation, then financial problems. Okay, these condition and some other may lead to the they make these elderly people more prone to depression. And then elder abuse. Abuse can be of any form. ये फिजिकल भी हो सकता है, साइकोलॉजिकल अब्यूज हो सकता है, इमोशनल अब्यूज हो सकता है, देन सेक्सुअल अब्यूज हो सकता है, फाइनेंशियल एंड मटेरियल अब्यूज हो सकता है, abandonment that is seen as a common in especially in urban areas, है ना, neglect and serious loss of respect and dignity due to low moral education. So these elderly people they suffer from these abuses. So these problems are common in this age group. Then the health problems that are mainly affecting the elderly males. So benign hypertrophy of prostate. Actually, with the in age, I think more than 50 or if more than 60, उन लोगों में कॉमन मिलेगा आपको ये ना benign hypertrophy of prostate this condition. Then prostatic cancer. It is also common in elderly age group. So then we have this screening. You can screen for these two conditions. You can do yearly digital rectal examination. That is a screening tool for both for benign hypertrophy of prostate as well as for prostatic cancer. Ideally, with the after completing the 65 years of age. तो 65 years of age के बाद एनुअली हो जाना चाहिए. नहीं तो अगर एनुअली नहीं कर सकते एटलीस्ट बाई एनुअली तो ये स्क्रीनिंग होना चाहिए फॉर बिनर हाइपरट्रॉफी ऑफ प्रोस्टेट एंड प्रोस्टेटिक कैंसर के लिए स्पेशली मेल्स में. Then for prostatic cancer, we have prostate specific antigen. That is, this prostate specific antigen is also used as a screening agent for prostatic cancer. Then we have other problem that these elderly people can have that male sexual dysfunction. This male sexual dysfunction can manifest either as a erectile dysfunction हो सकता है लोगों में, or they may have ejaculation problems or etc. Okay. Then now the health problems that are mainly affecting the elderly females. So menopausal problems. Menopausal problems may they may have increased risk of cardiovascular diseases. They may have genitourinary atrophy हो सकती है इन लोगों में. Then they may have skeletal bone loss हो सकता है इनमें. They may have skin and hair changes and neuroendocrine and vasomotor changes. ये सब चीजें. अब जो स्किन प्रॉब्लम्स हैं इसमें देर में भी लॉस ऑफ इलास्टिसिटी, स्किन की इलास्टिसिटी कम हो जाती है और देयर में बी apparent lagging, wrinkled skin, wrinkling appear हो जाती है, especially face पे you can observe it very easily. Then there may be dryness of mucosal surface, minor hirsutism may appear, voice changes आ जाती हैं. Then among the urogenital changes में there may be atrophic vaginitis or dyspareunia, that's painful na sexual intercourse. Then pruritus vulvae or irritable bladder. And neuroendocrine changes and vasomotor changes, these people may have problem like hot flushes, are psychological and mood problems, and these changes they affect the quality of life in this age group. Okay. Then the urinary incontinence, it is very disturbing problem. You know, it has a medical as well as psychological point of view. It is relevant from the both medical as well as psychological point of view. This urinary incontinence, especially in females. Then cancer and other disease of female genital tract, like uterine, endometrial, and cervical cancers. These are common in this age group. Then prolapse of uterus. It's a debilitating problem. That's prolapse of uterus. Then osteoporosis. Actually, osteoporosis can occur either it's a disease that affects both the sexes, male as well as female. But its impact as well as incidence is higher in females as compared to males. Okay, so this type 2 osteoporosis, there will be decrease in the calcium content of the bone. So, in type 1, due to the changes in estrogen level, that will be in females after this in during this menopausal phase. So osteoporosis results into trauma, and there will be fracture of at different sites, and most commonly it involves the major fractures will be at hip, spine, wrist, and pelvis. These are the common sites जहाँ पे ये fracture हो सकते हैं. So these are the problems that are common in elderly age group, and in next lecture we will discuss the preventive measures. क्योंकि हमने 2 लेक्चर में तो डिस्कस किया है, पढ़ा है कि what are the health problems that are affecting the elderly age group. अब problems तो हमें पता है. Then now we will go for the prevention and control of health problems of elderly. That we will discuss in the next lecture, because our ultimate aim is not just to know the health problems in this age group, but how we will prevent them. Hmm? As a community physician, as a public health no specialist, our focus should be on the prevention of these problems. So we will continue in the next lecture, hopefully. Thank you. Have a nice time.